counties in Mecklenburg County with more than 34 in North Carolina total. Let's listen in.
You guys ready to wait for anybody to go live or anything?
Okay, good afternoon, everybody. My name is Dina Diorio, and I am the Mecklenburg County Manager. And I want to thank everybody for being here for today's update on COVID-19. I am joined today by Dr. Sid Fletcher from Novant Health, Dr. James Hunter from Atrium Health, of course, our Public Health Director, Gibby Harris, Superintendent Ernest Winston, John Studnick from Medic, Chief Graham from Emergency Management, Chief Johnson, our Fire Chief, Jeff Estes from CMPD, Brent Cagle, our Aviation Director, Angela Charles, who's Assistant City Manager. And we're going to do this the way we've done this the last time. We're going to have Gibby come up and give you an update on where we are. We also will have some comments from Chief Estes from CMPD, as well as from Ernest Winston, our Superintendent of Schools. There'll be no individual interviews after, so please make sure that you ask your questions now, and we will stay as long as we need to make sure that your questions get answered. And with that, I will turn it over to Gibby Harris.
Thank you, Manager Diorio. Good afternoon, everyone. I want to let everybody know that we've had 3 additional cases announced this morning through the state, and that brings us to a total of 7. I do not have any specific information on those 3 cases right now. We have just gotten the information and are starting our investigations to understand where their potential exposure came from, where they are, and how we're moving forward with those. So as of now, we have a total of 7. We have, as of the end of 3/13, 259 persons under investigations. Those are individuals who have been tested and that we are following until we understand what their test results are. Those have been tested through both of our hospital systems, some through the health department and others through private physicians' offices. We are also continuing to monitor the travelers that the CDC has asked us to monitor, as well as any persons that we have placed under quarantine. Those individuals would be people who had been exposed to the cases that we have up to date. I want to speak just a little bit about the testing issue. There's been lots of questions about capacity and our ability to test. What I can tell you is that at this point in time, our capability outpaces our capacity. And what I'm talking about with capacity is supplies, but that continues to improve every day. But I also want to re-emphasize and emphasize that we have been able to test anyone who needed to be tested in this county. We have not turned anyone away who has the symptoms and meets the requirement for testing. Those who are being tested are either hospitalized patients with unexplained respiratory symptoms or individuals with symptoms of the flu or other viral type illnesses with a fever, a cough, and shortness of breath. Also, we're looking at individuals who have come in contact with a known COVID-19 positive individual, travel within the past 21 days to the specific areas that are of concern, or immunocompromised individuals. So I want to reemphasize again that we are not testing just anyone. We are being very specific about who meets the criteria to make sure that we're able to test the folks that most need it. Both hospital systems have websites. Their websites have information on them that helps people understand whether they are eligible for testing and also options for how they can find out about testing sites. I want to reemphasize that people should not show up without calling ahead. That puts them at risk. If they are not in need of a test and they show up at a testing site, they may be exposing themselves to individuals who are there to be tested who may be positive. In addition to that, they are potentially exposing those healthcare providers who are doing the testing when that is not necessary. So we need everyone to call ahead, and they can do that by going onto one of the hospital websites to understand how best to do that. And I also want to emphasize that the hospitals have set up sites for screening. These are not drive-throughs for anyone who would like to be tested. These are screening sites that are based on the criteria that I've just mentioned, and again, people need to call ahead. I also want to reemphasize the fact that 911 is for emergencies. If you have symptoms of a cold, a cough, a fever, you're well enough to get out if you're appropriate for testing and go get seen for that. You don't need to be calling 911. We need to be careful that we manage that resource in a way that best meets the needs of our community. I want to mention the fact, again, that our Emergency Operations Center is fully operational as of today. This center is doing the behind-the-scenes work, and it's significant work, that is making sure that we are providing a coordinated, comprehensive response in this community for the COVID-19 event that we're experiencing. I want to reemphasize prevention. You've heard it before, but I'm going to say it again. There are 3 levels of prevention. The first is personal, and we've talked about all of these issues before. Washing your hands with soap and water for at least 20 minutes. Using alcohol-based hand sanitizer if soap and water are not available. Covering your mouth and nose with a tissue or your sleeve, not your hands, when coughing or sneezing. Avoid touching your eyes, your nose, or mouth with unwashed hands. Avoid close contact with people who are sick. If you are ill with any of these symptoms, please stay home. Do not send, well, you can't send your kids to school, but don't send them to daycare. Also, continue to emphasize the need for a flu shot. We continue to see widespread flu in our area, so please continue to think about that. The second level of protection is environmental. You need to be cleaning and disinfecting surfaces that are frequently touched in your home and at work. The last level is community, and this has to do with social distancing, mass gatherings, and specifically those who are most at risk. We've talked about those individuals before. These are folks over the age of 65, those with chronic health conditions, and those who are immune compromised. The last thing that I wanted to mention today is the fact that, as you know, the governor issued a mass gathering order earlier that restricted to 100 individuals or less. I am signing an order today that reduces that in Mecklenburg County to 50 individuals or less. I want to reemphasize those areas that are not included in this order. Those are this is the Charlotte Douglas International Airport, public or private schools, well, not public anymore, sorry. Private schools or places of worship, spaces where 50 or more persons may be in transit or waiting for transit, office space, hotels, residential buildings or shelters, grocery stores, shopping malls or other retail establishments, and of course our hospitals. This could change at any point in time. This is an incredibly fluid situation, and we are hoping that the community will work with us cooperatively to prevent spread of this infection in our community. I want to turn it over right now to Deputy Chief Estes from CMPD about how this order will be reinforced in the community.
Thank you. 2 quick points from the CMPD's perspective in response to the order. One is we want to reassure everyone that the brave men and women of the CMPD are out on the streets of the city of Charlotte and of Mecklenburg County patrolling, keeping our community safe. Number 2, the order about mass gatherings of 50 or more will be enforced on an educational platform seeking voluntary compliance. We seek to work in partnership with all of our citizens in enforcement of the order. It is a public health matter. We have gotten good responses so far from many of our venues that hold these type events, and we expect generally voluntary compliance across the board in this in the future for this order. Thank you.
Now I'll turn the podium over to Superintendent Ernest Winston.
Thank you, Ms. DiOrio. Good afternoon, everyone. I'd first like to begin my remarks by acknowledging a colleague of mine who's in the room. Her name is Kathy Beam. She's the executive director of our school nutrition services program. Her and her team have worked tirelessly over the past several weeks to make sure that our students have breakfast and lunch meals over the next 2 weeks during the time that schools are closed. So with that, I wanted to share that beginning tomorrow, we will begin distributing grab-and-go breakfast and lunch meals at approximately 70 sites across Charlotte and Mecklenburg County to students primarily who meet the guidelines under the federal law is being economically disadvantaged. But I do want to say that these meals are open and available and free for all students ages 18 and under. It's imperative that our district continue to feed students who depend on receiving breakfast and lunch at school. So while schools are closed, we feel very strongly that we must ensure students have their most basic needs met, and meals is one of those things, and it's simply because it's the right thing to do. So let me give you a little background on how this will work. Meals will be packaged for takeout only. Meals will not be consumed on site. Staff will provide families an opportunity to drive through the parking lot at schools and pick up meals for children, and children must be present in order to receive the meals that will be provided. Schools will actually be providing lunch and breakfast for the next day between 10:30 a.m. and 12:30 p.m., Monday through Friday. And again, that begins tomorrow and will run over the course of the next 2 weeks. No identification is required to receive food, and students and family do not have to go to their home school. They can go to any of the 70 participating schools. We'll ask adults to stay in the car, and we'll have a staff member pass the meal to them based on the number of children who are in the car. I want to express my deep gratitude and appreciation to our community partners. And we have several who have reached out over the past week or so to offer their help and their assistance to make sure we're distributing meals to all students in our community who may have a need. And our community partners will be helping to distribute those foods to communities. They'll also be helping to package those foods. And so I just owe a great debt of gratitude to our community partners. Finally, I would encourage our families who are unable to make it to one of the approximately 70 sites to let us know that you are unable to come to one of the 70 schools, and we will make arrangements to have the food taken to you. So the food will be delivered to you. I'll be happy to answer any questions later on about that.
Thank you, Ernest. That's the conclusion of the prepared statements for today, but we are prepared to answer questions, so if you'd like to start.
Yeah, I
Yes.
guess if I may have Chief Estes.
Sure.
Chief, I know officers, all first responders, really out there, hands-on. The odds are that some, or one of your people will at some point test positive. What happens then? I mean, given the fact that they're often in big group roll calls and you know, they're out there dealing with other officers closely. Do you have a contingency plan in place?
Sure. The short answer is yes, we do, absolutely. One, I want to make a point that we are providing our officers with a couple of things to help them when dealing with the response to this public health issue. The first is, of course, PPE, education to create safe space, safe distance. We're also triaging calls that come in surrounding the COVID-19 so that we can adequately respond to them in a consistent manner. Lastly, if we should get a suspected case that reverts back to our public health officials to investigate and determine a course of action, who gets quarantined, who doesn't, and we would look to their medical advice and professional guidance and from the investigation as to what our course of action would be. I can tell you, though, that a roll call space or anything else would be immediately cleaned and sanitized to the best of our ability to help mitigate any spread.
Any positives so far that you're aware of?
None so far.
With this order now banning 50 or more, I'm assuming that means people should not be going inside restaurants.
As I believe, and I'll have to defer, I think the food service places, I believe, may be exempt, but I'll.
At this point in the state of North Carolina, there's not been any restriction on restaurants at this point. And considering the situation we have right now, we don't want to minimize people's access to food in the community any more than we have to. We're watching that issue very closely and looking to the CDC and the state for assistance with thinking through those issues. So that has not been limited yet. Restaurants are not included in the 50 or less.
Are they still being inspected? And if they are, can you talk about whether COVID-19 guidelines have been incorporated into the inspections at restaurants?
We have not slowed down our inspection of restaurants in this community and the other inspections that we do. That's continuing. The cleaning around COVID-19 is not that different than what we do with any other cleaning. So they are inspecting those restaurants at that level to make sure that what's happening there is protective.
What about other places like gyms? Are you going to expect them to do a head count? Are they going to be exempted so that people can exceed the 50? What's the expectation for other places where people gather?
Mostly what we're talking about with this specific order are those places where typically a one-time event or a situation where people are coming together for a single event. With gyms or sort of like restaurants, people can be, there's guidance that we're providing that will help them look at how to provide social distance. I was talking to one gym that was talking about marking off every other treadmill so that people have further distance away from each other, and they are cleaning those pieces of equipment on a very regular basis. So we're continuing to work with them and provide the guidance that is coming down from CDC to them to make sure that they're doing what they need to protect their patrons.
Is CATS receiving guidance from the health department regarding buses, light rail? We've gotten some complaints about no hand sanitizers being on light rail on buses, according to some passengers.
We have provided guidance. I don't know if the city would like to speak to that around the transportation piece. I mean, we provided guidance, and unfortunately, what we're seeing is that supplies are limited, just like you're seeing in the grocery store. And so we're trying to make sure that those who need those supplies have them, but there will be times, if people can carry their own, that's always the best bet. You have it with you, you can use it whenever you need it.
This question's for Chief. Have there been any discussions about new protocols when it comes to intake at the jails? When you have someone in custody, is there any changes as to bringing new people into the jails or anything that you have to collaborate?
Yes, we have been in close contact with Sheriff McFadden. There is protocols in place so that in case there was a person who was positive, could be isolated and processed properly. We are taking a common sense approach. I know that he knows it's a public health issue first, so of course treatment of the person would be the first priority before we enact any part of the criminal justice system.
If it gets to the point where there is a citywide curfew curfew. Is CMP able to handle something like that and enforce that?
Well, a curfew, again, we rely on the community compliance first. So we would be on an educational campaign first. Second, we would, in partner with our other local and state officials, work together, as we have in this case, to ensure that the curfew was, if we did have any outliers, that they were, the community was appropriately kept safe.
This question is for Superintendent Ernest. Superintendent, could you provide an update on any virtual learning as far as how teachers are being notified of what they should be doing, preparing today in schools, and then how parents are getting notified of what they should be doing for their kids?
Sure, I'd be happy to. So we have a cross-functional team from across the districts it's being led by our academics team that's working on a plan that will provide remote learning opportunities for our students, because we want to make sure that even though students would not be in school for the next 2 weeks, that we're still providing opportunities for them to learn remotely. We will be rolling that out and be sharing that information with families later this week. But it is extremely important. And one thing that's top of mind for me and my colleagues in the district is an issue around equity. We have to ensure that we're providing our students with access to devices, technology, hotspots, and so we're working with a number of community partners to make sure that that access is provided to our students who need that. We're working with families to identify students who may need access and technology so that we can provide the information to our students.
Situation where you would bring like school buses in to go and drop off supplies, or would families have to go to their school and pick them up? How would they get those resources?
So we'll be communicating to families that our schools will be open tomorrow to pick up any personal belongings or resources that students may need. We're still working to identify specific students who may have needs around technology and connectivity, and we'll be making sure that we get those devices to our students. The governor's office and our state education officials have indicated that schools from across the state have a deal of flexibility when it comes to what type of remote learning opportunities that we can provide to students. And so over the next 2 weeks, the guidance has been we want school districts to prepare for such a time when you would need to implement a remote learning opportunity. And so we're in the preparation phase, and it's certainly something that we want families to take advantage of, but it's not mandated or required. And we'll be very careful in our messaging to our families around the remote learning opportunities.
A lot of CMS teachers have kids of their own. If they, because their kids are out of school, have to stay home and take care of their kids, are you requiring them to take PTO in that case?
What we're asking our staff, we're providing a lot of flexibility around that, because we understand that employees who are families and have children in the district must take care of their basic needs first. So we're providing a great deal of flexibility to our staff. At the same time, we want to make sure that we're preparing for ultimate implementation of remote learning opportunities.
Steve.
I've got a question for Dr. Harris. What is it, we've gone from 100 to 50 in Mecklenburg County. What's the next step? Have you thought about that if the virus cases come through?
We're paying attention to the guidance and what is being said at the federal as well as the state level. Our rationale from going to 100 to 50 is the increase we're starting to see in cases, and the very real possibility that we have community spread at this point. That could escalate. but we just don't have that information at this point in time. So it could be we could reduce it to smaller numbers of gatherings, or I'm just not sure where this will go. It's changing every day.
Gibby, do you think that do you personally believe that bars should close down? We've already seen that in numerous states throughout the country. They're more and more adding it every day. Restaurants are not having dine-in only. They're only doing takeout only. Do you think that should be mandated?
I think we're getting to the point where we need to think about social distancing in a much more restrictive situation than we have right now. But I'm also concerned about people having access to food. That is another issue for our community, whether it's individuals who can afford to go out to eat every night, or those who depend on restaurants on occasion, especially with what we're seeing in our grocery stores. They're doing their best to keep their shelves supplied, but that's been a challenge as well. So I want to make sure that any decision that's made is thoughtful and that it doesn't have unintended consequences for our community. So we'll be very careful about how we put that guidance out as we move forward, and again, listening to our state and federal partners.
Can you elaborate on cases 3 and 4?
Fred.
I'm sorry. Just two questions. One, when you say 50 people or less, I guess I'm trying to still figure out which type of events would be affected by those types of numbers.
If you have meetings, trainings, concerts, obviously we don't have any sports events right now, but events like that are scheduled that are not weddings, if you can limit the number of people that you're bringing together, and also think about who you're inviting. I'll give you a personal example. My mother-in-law is turning 98 in early April. We have canceled her birthday party. We had individuals coming from across the country to visit with her, and we don't want to put her in that situation where she could potentially be exposed. I think you need to think about this in your personal situation and limit your exposure as much as you can.
Right here.
Superintendent, as we move on forward, how will we deal with CMS staff's pay?
Well, what the guidance from the governor's office and our state education officials is such that all school district employees can expect to be compensated over the next 2 weeks or the duration of the executive order.
What about substitute teachers who aren't necessarily district employees but brought in an external company?
It's my understanding that the executive order did not incorporate substitutes.
Right here.
Gibby, can you please elaborate on cases 3 and 4? Do you have any more information about how they may have contracted COVID-19?
Both 3 and 4 had external travel. One was from the European area, and the other was from a conference, an international conference in the country. So we know that both of those were tied to travel. The 3 new ones, we don't have that information yet.
There you go, right here.
For the superintendent, a two-part question here. While schools are closed, are you planning any type of deep cleaning, any extra cleaning measures there? And then what do you need to see in the next week going up into your 2-week break that keep schools closed longer than additionally past these 2 weeks?
The answer to your first question is yes. We will be cleaning our schools as well as our school buses. And the answer to the second question is that, that's a very hypothetical question. And this situation is changing so fluidly that we're monitoring the situation day to day, and we're making decisions as such.
Right here.
Yeah, I guess city leaders are here, so I'm going to ask the city, is there any particular reason why we haven't heard from the mayor, and will she be speaking anytime soon?
Tonight at the zoning meeting, there will be an opportunity then to talk and hear from our mayor.
I was just wondering, though, why hasn't she addressed or said anything?
I cannot answer that at this time, but we can definitely get back with you.
Tanya.
Dr. Harris, do you know today how many people you have the capacity to test?
I don't have exact numbers at this point because it changes every 15 minutes, depending on how many people we've already tested. But what I can tell you at this point is we do not believe there's a problem with capacity when it comes to those individuals that we're needing to test at this point. That's the good news. And we also know that that capacity is continuing to grow. We're seeing some relief and supplies coming down to the county. Would we like to test more? Potentially, but right now we're able to test those who really need it.
Last question.
Two-part question. Are any of the 7 cases county or city employees or family members of that? And are movie theaters and funerals also considered one of the events that would be a mass gathering as banned?
So to the first question, to date, we do not have any city or county employees who have tested positive. And the second question, funerals and movie theaters. Movie theaters are not included as long as there's not more than 50 people in the theater, in that individual theater. Just passing through into the theater, as long as there's no more than 50, they're excluded. For funerals, I would suggest that people think about social distancing, no more than 50 people at a gathering at a time.
Not family members of city or county employees either for those cases?
Not yet. Nope. I think there's always that possibility, but not to date.
Okay. Thank you, everybody. Appreciate your time today.
We've been listening to a press conference here, an update on the coronavirus from Mecklenburg County health officials. What we learned today is 3 new cases for a total of 7. That is just here in Mecklenburg County. Mecklenburg County now taking the governor's order one step further. The governor's order was to limit crowds in the state of North Carolina to 100 people. Mecklenburg County is going to scale that back and do it down to 50. So no crowds more than 50 people. CMPD said they will enforce that on an educational basis at this point. One of the bigger items mentioned at this press conference, if you just joined us, CMS will be feeding breakfast and lunch through 70 different pickup locations because there are a number of kids in Mecklenburg County that are on free and reduced lunch, and they rely on breakfast and lunch at school for meals during their day. So through 70 different locations, those locations have yet to be announced. CMS will be providing Monday through Friday breakfast and lunch for the following day. A lot of information. As you heard, we've got a lot of reporters there. Our reporters are there asking more questions and getting more details about what we've just heard. We'll have the latest information for you coming up today on the news at 4 o'clock. Until then, we're back to regular programming.